So my name is Lara Barrett, and my daughter Jessica was referred to the core speech and language team when she was 2 years old due to having suspected ASD and communication delays. And when she got seen in the core speech and language, they discharged her due to her being pre-communication and that she wasn't quite ready to do all of the strategies that they would have in place to bring on a communication. I was a little bit disheartened because I thought, oh gosh, my daughter's pre-verbal, she doesn't communicate, she got a lack of understanding. What do I do now? Where do I go for support? And then I was told about a course called Building Blocks for Communication that the speech and language team provide over Teams as well. So it benefited me in my working environment because I could do it during my working practice. So with my daughter, she only communicates with holding your hand and pulling you towards an item of a desire or a need. She doesn't speak at all. She has no words. She stims a lot. She doesn't follow simple instructions. She doesn't understand an instruction. She scores no green on her welcome, which means that she's not age appropriate, and not only that, but she's of a 6-month-old baby stage of communication. So I was very anxious about trying to bring on that communication, especially then when she had her diagnosis of ASD when she was 2.5, because my son has previously been diagnosed with ASD, but he is verbal, so it was a completely different situation to the one that I'm experiencing now. I didn't know what to do to help support a pre-verbal child speak or communicate. And I was under the assumption that she had to speak to communicate, and I would need her to hear her voice to know what she wants. And when I was then referred to go on to the Building Blocks for Communication training, it opened my eyes to understand that a child doesn't have to speak to communicate their needs, and there are things you can do to support their communication and their play skills and their learning and their understanding even. And I didn't realise there was so many different areas of play and different levels of play and different levels of communication that a child needs to go up in scale to then be able to communicate their needs with you effectively. So during the course then, I learned different strategies of how to support Jessica and how to be patient with her and learn with her rather than try and force a communication that neither of us would fully understand. So then after we were coming to the end of the communication, I was asked how I felt it was working. And at that time, I believe you need it's a long, steady progress, which you have to have a lot of patience for because it's not something that comes overnight. And when the Building Blocks for Communication then finished, I realised that was the main important thing that I needed was the patience, and giving Jessica the little special time that they talk about in the Building Blocks Communication, just that 30 minutes every night, just one-on-one, getting down to her eye level, speaking in simple terms, simple effective play with her. We're looking now that we're probably 2 months on, and the progress in it is just amazing. She's now able to make a choice where she wouldn't make a choice before. So if I hold out 2 objects, she's now able to choose one rather than push them or throw them both away. Because I've constantly been maintaining that level of communication with her, so she's learned how to do it in time. And I now have confidence that even if she doesn't speak, at one point she will be at the level where she might be able to do pecks or a bit of sign or any other form of communication that will just get her needs across to us. Which one? One? Which one? Pink. Pink. Got it? Okay. Yay. Jessica, let me have this one. Ready? Which one? Yellow. I'd 100% recommend the course. It's given me confidence, it's given me knowledge. I work with children with speech delays and communication delays within my work. But when it comes to pre-verbal children, I was a bit confused on how to help them progress and develop. And now I feel I have that confidence in me, not only personally in my private life, but in my professional development as well. I now feel that I've got that experience and knowledge to help these children get the best out of the communication that they can.
Yeah.